Good day on behalf of Patient Choice in Chemin, Pointe, Michel. I'm Dr. Dangleben with your daily medical tidbit. What do I want to talk about today? We're going to talk about a very, very important topic. Diabetic neuropathy. Diabetic neuropathy. So what is diabetic neuropathy? It's a nerve damage due to long-term high blood sugar levels in diabetics. It mostly affects the legs and the feet, but it can also impact other parts of the body, including your hands. Right? If you have chronic high blood sugars, that damages the small blood vessels, especially what we call the capillaries. Okay, that supply the nerves, right, in the lower extremities. And if you have blood vessel damage going to the nerve does not get the oxygen and the nutrients that it needs to function. So it begins to malfunction, and some of these little nerves will die over time, right, causing the neuropathy that I'm talking about. And the risk factors is poor diabetic control, long duration of diabetes, high cholesterol, and high blood pressure, smoking. Okay. So what are some of the symptoms? Numbness or reduced ability to feel pain or temperature. Because remember, pain and temperature goes together. A lot more basic science, neuroscience than I want to get into. And then you develop a tingling, a burning sensation, right? Then that becomes a sharp, jabbing, almost like an electric like pain. All right, and over time, because the muscle is malfunctioning, the muscle group in that area gets weak. Because remember, there's muscles in your feet, okay? Very intrinsic muscles that are very important. And over time, as this gets worse, you begin to lose coordination and balance, especially in your feet, all right? And in severe cases, you get ulcers, diabetic ulcers, and then it gets infected, all right? And a lot of times, the minimal injury goes unnoticed. You could step on a little splinter or tack. You could have a small cut, a little burn, all right? And in a non-diabetic, that might not be an issue, but in diabetics, it gets worse, it gets infected, and it becomes something that's life-threatening. It really is. How do you treat this? The most important thing is controlling your diabetes, blood sugar control. All right, and I talked about hemoglobin A1C in the previous talk. Follow up on that, right? There's certain medications like you've heard of, Neurontin and amitriptyline. These medications can help, but again, you would prefer your sugar to be controlled versus letting it get to the point of getting these medications, right? There are a few things over the counter, topical treatments like capsaicin, lotions, and things like that. But again, blood sugar control. All right. Inspect your feet. If you cannot get down there and inspect your feet, have your loved ones do it. Have your family do it. Take a look. Look for little breaks in the skin. Prevent ulcers and infections. And again, I have emphasized many times lifestyle modifications. Do some exercise. If you're smoking, try your best to quit smoking. I know it's a horrible vice to quit, but you have to. Manage your blood pressure. Follow up with your docs. Get your lab work done. Is your cholesterol high? Do you need to be on a medication? Make the necessary changes. Lose weight. Very, very, very important. All right. I talked about vitamin B. Make sure you're not vitamin deficient because it will make the neuropathy worse. All right. There's a lot of complications that can happen because of neuropathy, and I'm sure many of us in Dominica know someone or is close to someone who's had a complication, whether it's a diabetic ulcer with infection, amputation, whether it's amputation of the toes, the forefoot, the distal limb below the knee, above the knee, right? We call that BKA, AKA, all these things. We don't want that, right? Over time, erectile dysfunction in men becomes an issue. And people just think, well, it's because you're taking the medication. That's why you get erectile. No, it's because you're having worsening nerve problems because of uncontrolled sugar. That's why you're having these problems, all right? So the bottom line is diabetic neuropathy is preventable and manageable by controlling your sugar. The earlier the better. Monitor your sugar. Go see your doc. Have a conversation with your doc. And for the docs, have conversations with your patients. Explain these things to them. Okay, so we could see a reduction in ulcers and infections and amputation. That takes a big toll on the individual, on the family, and society as a whole. That's my topic of the day. It's very important to us that we control the diabetes epidemic that's taking place. Have a great day. God bless. Peace.